Okay, you can start.
Good evening.
Good evening.
Uh, uh, I'm Dr. Sridevi. I believe you know me, Jasmine, right?
Yes, doctor, I attend daily rounds with you.
Yeah. So, Jasmine, how is your rotation going on?
Yes, doctor, it's very nice. I am interested in neonates, and yesterday it was very busy. We saw so many small babies yesterday.
Yes, that's good that it's interesting. You're liking this subject. I
Yes.
know it's very busy. Yeah. Yes. Okay, so, Jasmine, I heard that you want to discuss something with me regarding yesterday's case. Uh, may I know what do you want to talk about it?
No, doctor, actually nothing. Only one
Mm-hmm.
patient I saw, I feel that I saw was sick.
Mm-hmm.
Uh, he's Sami.
Mm-hmm.
12 days old baby, and some medications were started for him. I gave him also started acyclovir for him because for his sepsis and suspected meningitis like this, and I feel that he's doing fine now.
Okay, that's great that he's doing well. Uh, actually, Josmin, there has been a concern raised that Sami has received the double dose of acyclovir. So, anyone has talked to you about it before?
No, doctor, no, I don't know about it. Is it he received double dose? You mean the increased dose? Oh my God, maybe this will affect the baby. I am really afraid. Are you sure, doctor?
Yes, Jasmine, we have cross-checked it. I know you are worried, and yeah, as a
It's
human being,
me.
mistakes happens with
Yeah.
everyone.
But
Yeah.
doctor, it's me who prescribed the acyclovir. Do you think that made, I have given him the wrong dose?
Yeah, unfortunately, Jasmine, yeah, it's a wrong dose. But I want to like assure you that as you told, the baby is doing well. Okay. And as you know, as a human being, we can do many mistakes. But the thing is, from this, we should learn so that we will not repeat it. What do
Oh,
you think about it, Jasmine?
you're right, doctor, but I think they will remove me from the job or something because I'm just new and I'm making such a big mistake with a small baby. Doctor, I request you don't tell the parents, please. Don't tell the parents, please, doctor. Is it
Okay, Jasmine,
possible
I
that
can I
will?
can understand that you are very much worried about your future and all. But Jasmine, as you know, we should be very transparent. This is our like no ethics
Oh
that
my
we should be
God, doctor,
transparent
if
with
you
our
tell the
parents. Yeah,
parents, if you tell the
but
parents, they will complain against me, and our chief will remove me from the hospital. Please, doctor, don't do this, please.
yes, I completely understand what you are going through. But I can assure you that it's not that we are going to blame you or something. Okay, from this mistake is it's like going to learn whole team so that it will not be done again.
Okay,
Okay,
maybe
and
the
it is not. Yeah, yes.
doctor, I'm very much worried. Maybe the mother will ask you who did this, or someone, she will ask someone and they will give her my name, and she may go and complain, particularly telling that Josmin is the doctor who did, and I will have problems, doctor. Really. Now I'm very much
S-
worried.
yeah, Jasmine. Like, see, in our hospital, in every hospital, actually, we work as a team. Okay, if something mistake happens, it will come to whole team. It's not like only like they will point to you, and we don't disclose the who has done to the parents. Okay, am I clear so far, Jasmine?
Yeah, but doctor, whom should I contact now to do to this? Because it's a mistake. I am sure that the parents will complain. So for this, whom should I contact or do anything? Should I
Yeah,
do
first
anything?
of all, actually, it will be like already consultant must be knowing about it. Okay. And also you can contact your educational supervisor if you have any query regarding this.
Okay.
And do you know what we do if something like this happens? What is the policy in the hospital?
Oh no, doctor, this is the first time happening with me. I don't know.
Okay. Okay, so don't worry. I will explain to you what we do. Yeah, so actually we do the incident reporting. Okay, that means that will involve the consultant, the nursing supervisor, all the group, they will know it, and they will try to find out like where the problem happened. Because it's, see, any medication has been prescribed, it was should be checked by the pharmacist. Okay, and then from after pharmacist, it also like no double checked by the nurse before giving the injection.
Okay,
So
six
it's
minutes,
not only at,
3 minutes left. 3 minutes
yeah,
left.
okay. So here what happened, not only like you have written, after that the pharmacist also missed it, and even the nurses have missed it. Okay, so as a team we have to find out like what changes we can do it so that it won't happen again. Am I clear so far, Josephine?
Yes, doctor. Yes, you are clear. So now I have one more question. If
Yes.
with acyclovir we gave him double dose, now should
Mm.
we leave or should we stop at the moment? How should we proceed with it, doctor?
Yeah, we will actually observe the child. Complete monitoring should be done because they can have different side effects. Do you have any idea what they can have? What
Mm,
side effects they can have?
no, doctor, because
Okay.
it's not a common drug which we
Yeah.
give it.
Yes, I can understand absolutely. It's fine. So they can have some like no GI problems, sometimes vomiting. They can have some kidney involvement. That is what the worst thing can happen. Okay. And also sometimes neurological involvement can be there.
Since
Okay.
we
So, but
give double dose now, should we check the level in the blood?
yeah, we can do a blood check, but I'm not sure about the whether they do the acyclovir blood level. Okay, but usually we can go through and about it together, and we can find it out. Okay.
Should we contact
Uh,
the toxicology center, doctor, to know, because we don't know what it will cause, and should we check the blood level or how should we proceed? Can we do that? Because I have seen
yes,
numbers as in the notice board. I saw some numbers as.
yes, Jospin, you have very good idea, like no, good knowledge about it. You are right that we can contact them. Okay, and
Okay.
we can find out what
I
side effect.
hope.
In many cases we don't know, right?
Yeah, I
So
hope
Jasmine, I think,
little Sami will be fine, doctor. I hope.
yeah, yes, we are all closely monitoring him about this. Okay, if anything needed, we will intervene immediately. So Jasmine, can you summarize what we have discussed till now? Because if anything, you have any questions, we can continue in another meeting. Okay, so can you please summarize?
Yeah, yes, doctor. Today you discussed to me about the accidentally we gave double dose of acyclovir to Sami,
Mhm.
and presently he is fine, but we need to monitor, and we also wants to check if nothing goes wrong with him, and we can check with the toxicology as well, and also we have to make the incident report of this to see where the problem happened, and this should not be repeated. And I can also contact my education supervisor to do to be clear what can be done about this.
Yes, Jasmine. Yeah, I can see that you like no, you're a very fast learner and you've understood all the things. So I will give you some leaflet and you can go through this trusted website and about the acyclovir overdose, what can happen, and even we can go through it together. Okay, and if you want any other questions or anything you want to ask, we can arrange another meeting.
Okay,
Okay.
doctor. Thank you. Time finished. Okay. I don't know. I don't know how was the role playing. Was the role playing okay, or it will be even more bad? I don't know.
Dr. Noor, please repeat the task once again.
Okay, I will repeat the task. The task was Sami was 12 days old child presented with febrile illness and reduced feeding, and neonatal sepsis was suspected and was started on the antibiotics after taking the cultures, but he was also on acyclovir, and double dose of acyclovir was prescribed by the ST3 Josmin. Okay, so you have to tell her. You have to tell her about the incidents and also answer her concerns. Actually, I have comments, but for Dr. Shri Devi, but before that, anyone wants to give the comment? It was not missed dose, Dr. Krishna. It was not missed dose. It was given double dose of
No, I mean to say we will miss one dose.
Okay.
Yeah.
I don't know.
We will wait. Yes. Double dose means we have to wait before giving next dose.
We will wait. We are not sure, right, of checking the drug level of acyclovir.
Yeah. I don't know actually, because they can do all the drugs they are doing or not. I have no idea. This acyclovir never.
Just one thing I have this
Was a
comment.
previous
Acyclovir
exam
is checked, I think.
okay?
Actually, I didn't have time also. Maybe a little bit of personal question should be asked, but I didn't have the time.
No. Your starting should be little different. This is what I want to comment. But before that,
But,
Okay.
I felt, Dr. Noor, that Dr. Sridevi was very nicely you have done, Doctor. The only thing is that you were very polite and kind, and you were pacifying the role player. It's fine. This is kind of a, like, at least Dr. Noor was a very nice role player who did. Otherwise, I have seen, in this way, where the role player would say, okay, it's fine, means I can do. Then you will say, no, but it's not allowed. Okay, that means they will take they'll take action against me. No, but it's fine. Then you say, okay, even if, for example, the role, if you say, even I have done such mistakes. Okay, so even you have done, so even I can do. Means this kind of role player can take you for a ride if it required. Still, Dr. Noor
If
did a
they
very nice job.
are like very harsh, means we have to be little bit again. Then like repeated means you can have some
But
some,
I
we
think
have to go
twice you
like
feel
that.
that it is a human error, this happens, but then it seems like it's fine kind of a thing. So that was, I think, a little would have been unacceptable that
Actually, that
it's
is
done,
what.
but
Actually, I attended one mock. Okay.
yeah,
Regarding like this overdose only, and I'm
yeah.
talking to a nurse, and the completely it is was just you have to reassure because she is tensed. Okay. This is what they
It's a
say.
reassurance instead of saying, I'm just saying that even I don't know, but
No,
we should use some other words where the person does not feel it's okay. At the same time, the person feel that person doesn't get tensed. You can like say that I do understand it's a mistake and we need to learn from this mistake. So let that mistake not have a bad effect on you by demoralizing you. I see you're an enthusiastic doctor, right? So let this mistake have an effect on you where you learn further. So probably in this way, you are neither encouraging the mistake and nor are you causing stress to the person, I feel. I don't know, I may be wrong, but
yes. Musna, what you said, can you tell again?
I was just saying that I know that you are tensed with this mistake, but at the same time, I would like to say that this mistake, rather than de-energizing you and demoralizing you, like I saw you as such an enthusiastic student, right? So instead of that, it's better that we learn from this mistake so that you can provide better patient care. And Dr. Sridevi, actually, what has happened? They give us the task that you have to talk to this person regarding the drug error. So I think a little that you want to talk to me. So she would directly tell you, if Dr. Noor would tell you, no, I don't want to talk to you. Why have
Yeah,
you come
yeah,
to
yeah.
me?
This is what
You
I
know, she would
wanted to tell her. Yeah.
It could be
that
difficult
is,
colleague also.
that was kind of Dr. Noor to tell that I have managed one patient
No,
and I
because
have.
I wanted to continue the scenario. Actually, I wanted to tell this after the scenario that starting you will tell like you
Come
will
to the
just ask
point.
her. You know, it was fine that to ask her how is the rounds and how is the means her postings going on, everything is fine. After that you can tell her that Josmin, I am here to talk to you about an
Yeah, about an
incident that happened
incident.
like this.
Yes, yes.
Rather than asking her you want to talk about some, actually she
No, it was like I have to talk because I got like no ulta. Like
So
she
you
wants
have
to
Yeah,
talk
to.
yes.
to because of
We
she said.
also,
That's why I started like this.
yeah, we also perceive like a medical student. She want to know what is drug error like this.
no, here no, the medical student did not arrange any meeting with her. This was the incidents which has happened for which you will go and talk to her. You are the
Talk
one
to
who is
her.
talking
Okay.
Yeah,
to her.
yeah.
This
Okay,
is
So
okay.
the scenario
understanding the
here. So
task
we have
is
to
Yeah,
understand
yeah.
important.
here.
Means I'm disclosing the things. But once she
Yeah,
told that I don't know,
exactly.
then I thought actually, yeah.
Yeah. This is critical incident. So you will tell her that Josmin, I got to know, I am here to discuss you about the incident happened about the Sami 12 days old child. Accidentally he received double dose of acyclovir. Do you know about this patient like this? Then she will tell, yes, doctor, it is me who prescribed the dose like this. Okay.
And one more thing, when she was getting scared that the mother will come, why are you telling the mother? Why are you telling? So just one thing, this comes under the umbrella term of clinical governance, that we can see that this is that you rightly said, that being transparent, being honest is our NHS network. All our hospitals over here, it comes under our clinical governance. I know it might be a bit temporarily not you may not feel comfortable with this entire thing, but in the future we will be very careful with patient care. If we are transparent, covering up will give a very bad medical practice. Of course, this in nutshell is not talking for more than 30 seconds, but
Okay,
you said all that nicely. I'm
Dr.
just
Fatma,
adding to that.
I don't understand who is prescribes the wrong dose. Medical student who prescribes the wrong dose, or doctor, or who?
Doctor, ST3 doctor. It's a doctor. It's not a
ST3.
medical student.
A medical student just ask about why this doctor prescribe wrong dose.
No, this is a
No, she
junior
is the one
resident.
who prescribed.
She is
Josmin
a
is the
junior
one.
resident. You are a senior, and she has prescribed the wrong dose. Now you have to talk. This is not a medical student at all. This is a doctor who is working. She has come, she has joined, and she has prescribed the wrong dose. Now you have to tell your junior that this is don't get just talk to her. Let's see. This may be
But also we should tell him, we will tell the consultant or the supervisor. We should tell him like that.
We make an incidents report. We will involve our consultant, nursing supervisor, and if the patient,
collapse.
the parent want to complain, we will be transparent and we will tell them all these things we told.
But but we will not tell the parents the name of the doctor.
She asked her. This question was asked. You will give the name doctor. You will give. No, then she said you will say that this is a system of prescription and many people are involved in this. It's a system error, not one person's job. If you want to complain, you will guide them. I think the patient advice and liaison service, right? PALS.
I was just wondering, Dr. Noor, that in newborn, as far as I know, that the acyclovir dose is double. In pedia, we give 10 mg per kg, and in newborn, we give 20 mg per kg per dose. So I thought this is a hidden agenda that the pharmacist is wrong in raising the consent. Concern. It's actually she has given 40 mg per kg.
See, they did not mention you a particular dose here, 20 mg or 10 mg. So
Yeah,
you
yeah.
Also, I think acyclovir is a neurotoxic and can lead to kidney damage, renal failure. So we should tell him to do renal function tests and so.
Means what we'll do next.
okay, we had enough discussion. So Dr. Muzna, you are free.
Hello, Dr. Noor.
Yes,
Yeah.
Yeah, I have something to say here. Means I think here we can also add like means Jasmine, do you think how can we avoid such kind of mistakes? So maybe you have written the dose in a whole. It's always better to write the dose per kg body weight so that it will be checked by the pharmacist and nurse. That will be easy. So otherwise they may also overlook what is the dose you have prescribed.
Yeah,
Maybe
we
this
can,
could be one
you can
suggestion.
ask a question her how to avoid this, and she can tell you that we always the dose has to be double checked, and also better to prescribe with generic names than the trade names if there is any confusion.
Yes, a few suggestion in such cases, critical incident, how can we avoid in future such incident? So you can suggest.
Yeah,
like
double
this.
checking, alerting everyone, the pharmacist, the nurse, to double check the doses before they dispense. The pharmacist before dispense can check, and the nurse before she gives can check. If she has doubt, she can contact the doctor. And also to check with the trade names and generic names. Okay, and also to describe the doses in mg, because some ml mg, no confusion, always prescribe in milligrams, and be sure per kg body weight dose, like this. You
Yeah.
have,
So here,
yeah.
so here we can ask one question to the role player. Do you think how can we can avoid such things happen? So see, she may say any one of these, then we can suggest something.
Mm. Okay, we will just, it will take just 9 minutes. We will just do this again, and then we will go to the next scenario. Okay. Why, Dr. Krishna, you are telling never do that?
Hello, you will ask the patient's parent to how will we improve. He will tell you
No,
that
no
you are.
patient parents. It is doctor, another junior colleague.
Talking about the doctor.
Okay.
Okay.
To the
You,
junior
Dr.
doctor.
Muzna, you will be the role player for this.
Okay, okay, I'll be.
Okay.
What's the answer for the toxicology thing, Dr. Noor? I don't know.
Yes, you can contact. Now you don't know. I asked her one question about, do you check the drug level? I asked her because she is a doctor, right? Josephine is doctor. So she's asked her, do we check the drug level? And we are also not sure about many more side effects. She just told me about the kidney involvement. What someone told about neurotoxic, what it does, doctor? Can you tell me? Who's Dr. Aparajit?
Actually, GI, neuro, and kidney. I told 3.
In neuro, what side effects? Any idea?
They can have seizures also, up to seizures. Coma also if it is very high dose.
Yes.
Also, hypotension is one of the major effects. It's like hypotension.
Okay.
Dr. Noor, have you ever had
Acute
the
kidney
name
injury,
of Dr. Noor?
What? Tell me, Dr. Tamanna. Go ahead. I am listening you.
Sorry, Dr. Noor. Yes, sorry, I got a call. Have you ever heard the name of neon sign? I don't know. In some meeting, I heard the name of neon sign in drug error. How we can prevent this neon sign? How we can prevent future drug error? We can double check. This is number 1. There is another neon sign. I forgot. Sorry, I cannot remember.
As far as I know, what I said, this is what I know. Double check, always prescribe
What is
the
that?
dose
I'm searching for
milligrams.
internet. I did not find neon sign in drug error.
I think the neon sign is the use of this fluorescent pens to label so that you don't mix it. When you label for different patients, you use different colored pen, like all those fluorescent pen.
Okay, so can we tell like it has a from the mild effect like headache, nausea, vomiting, to the various effects, and we can maintain the hydration for present, and then we'll see how it goes, and
Yeah,
probably it will
the
come
main
out.
thing always we will tell is presently the baby is stable and we are
Yes.
monitoring the child. This is the thing. And when she asked about contacting toxicology, surely you can do it. You can tell that like this we have given, this is the age of the baby and this is the weight of the baby and he has received so and so dose. How can we proceed with this case? You can consult with toxicology. They will give you the idea because they deal with drug overdose, right? And for her to avoid is that we will make an incidence report to see where the problem happened and this should not be repeated. Consultant and the nursing supervisor and all will be involved, and double check, write the dose knowing the weight properly in the milligrams per kg body weight, and even the pharmacist and the nurse and whoever involved should double check before giving to the patient like this. Anyone wants to add anything apart from this? And also tell her to check with the generic name and the trade name. Just if she's not known, if she don't know about the proper trade name, if she has any doubt, she has to check the generic name before prescribing to the patient with the dose and strength.
Dr. Noor, I have one doubt. We don't have even summarization was difficult. I had to stop suddenly. So when we will tell all these things, so many information.
Sometimes summary, they say that the concern of the role player is more important than summary. If the
Yeah,
role
but you
player
know,
is
in
going
the
on,
Jeddah exam, who was the head examiner, he told you have to summarize whatever it is. You have to manage and you have to summarize before exam. He told everyone, all the candidates.
He told before exam?
Yes.
Oh, okay. I didn't know this. Then we will
So,
stop. We can tell.
yeah, that's what we will tell. Like you, I know you have so many questions. We can take up all the questions in the next meeting, and we need to summarize something we have to do and manage our time. That's what they told.
Okay.
Or else we can say them that we do. I know your concerns are there. Do make a list, and we can address to that further. Something like that, like the way you said. Jeddah is known, you know. Jeddah has this one role player who's always hyperactive, whose job is not to allow the candidate to summarize.
This time all the role player were there like this because maximum they were it seems medical student, and it is very hard. Even one communication, it was to medical student, and when the candidate asked her to summarize, she told, oh, I can't remember anything, please summarize for me, like this she told.
Very nice.
So we cannot tell them anything, right? They can tell us anything, we cannot tell them anything.
Yes, they are checking your patience. Patience, perseverance, everything. Okay, let's not waste the time. Anyone can see, really this time will distract me sometimes. Someone can volunteer.
I'll keep the time.
Okay. It's not disturbance for you, it's okay?
No, it's fine.
Okay. So when you're ready, tell me.
6 minutes, right?
Okay, yeah.
I'll start.
Wait. You are Josmine and I am myself. Okay.
And you're Dr. Noor.
Okay.
Start, huh?
Yeah. Good morning.
Good morning.
Hi, Josmine. How are you?
Yes, doctor, I'm fine. How are you?
I am also fine. How are you finding our unit?
Oh, it's really great, and I'm enjoying the work, and I really love managing these sick babies, and with and I'm getting so much of things to learn, and I can manage this. I'm really happy, doctor. I'm really happy.
Oh, that's great. I am very happy to hear. Josmin, actually, I am here today to discuss about an incident happened about the baby Sami, who is 12 days old. He received accidentally double dose of acyclovir. Do you know about it?
Sammy, doctor.
Yes.
Yes, yesterday I was the one who was primarily managing him, and I was so happy that I suspected this sepsis and his liver enzymes were raised. Hence, I started acyclovir. No, doctor, it's not possible that I have checked the dose and I've given it.
Yes, Josmin, I understand, but I received the message from the pharmacist that a double dose was given to Sami. So I am here to inform you about it.
Well, doctor, just let me check on my app. Oh my, that was per day, and I thought it's per dose. Oh, now what's going to happen? What's going to happen, doctor?
Yeah.
Doctor, is Sammy well, or is he unwell?
Actually, Josmin, just now I checked him. He's fine presently, and we are monitoring him. But what I want to tell you is we have to avoid these errors. This is the main reason why I want to discuss with you.
Yes, doctor. I'm really feeling very bad. This is really this is not even some drug like a simple drug. This is, as far as I know, it's a very nephrotoxic drug. It can fire the kidneys. I remember one of the consultants telling me that.
I agree with you, Josmin. Actually, see, what I want to tell you is how we should now, the incidence has happened. Now we should learn how to avoid it. Before that, I want to tell you that we will be writing an incident report, and we will involve our consultant and the nursing supervisor and the important hospital staff to discuss about it, to find out where this issue happened and to try to solve this. You're with me, Josmin?
Doctor, that's really clear. It's my mistake. It means basically you're writing a complaint against me, right?
No, it's not a
You're
complaint.
not supporting your colleague.
No, it's not a complaint. It's an incidents report where we'll write the incidents happened with this baby, and we should avoid that this should not happen with other babies.
Doctor,
Okay?
you should be supporting me, right?
Yes,
I
Josephine,
assure you I'll not do this
actually,
mistake in
yeah.
future.
But in the incidents, we will not be writing that the name of the person who prescribed it. We will just write that this happened and this should not be repeated. So we will involve the pharmacist, the nurse to double check the things after doctors prescribe. And even for you, we will have a meeting and tell that you should always recheck what you prescribe to do the best.
But doctor, you'll tell the consultant. So how will the consultant trust me next time?
Actually, Josmin, mistakes can happen by anyone. We are here to see to it that this should not be repeated. This is first thing. The second thing is we are equally monitoring the baby to see that he should not have any adverse side effects from this acyclovir. Both we are doing,
So
because,
doctor,
yeah.
you feel that means the consultant will feel it's acceptable, means even you all have done such mistakes?
At one point of time, sometimes maybe if we are busy or we are bombarded with something, we can do it, but the thing is we should try our level best to avoid it. So the incidents reports will help us, will make alert everyone that this has happened, we shouldn't repeat it again. This is the purpose of it.
Doctor, how will we come to know that Sammy is not getting affected?
Yeah, this is a very good question. Actually, we will monitor him, both his temperature, vital signs, and everything. He will be under our monitoring. and his urine output. If he doesn't has any seizures or anything, he will be monitored. And also we will delay the next dose. We will calculate his correct dose, and maybe we will delay giving it. This is how we can manage. At the same time, we will contact the toxicology center to find out.
Okay. Okay, doctor.
6 minutes
But I
will be
hope so
okay?
the parents will not be informed, right?
No, Josmin, actually, I want to be clear with you. We have to be transparent with the parents because it's their child, and we should tell whatever happens to the child to the parents. So we will convey them this message.
My,
At the
oh
same
my
time,
God. Oh my God. I really don't feel like working in this hospital. The 6 minutes
no,
are over.
no, Josmin,
My,
don't feel like that.
it's really traumatizing. Just imagine what the mother is going to do, doctor.
No, don't.
Probably my license will get cancelled by her complaint.
Actually, what we'll do, you will, there is a department in our hospital which will guide you when mistakes will happen. Okay. And also all the doctors will have medical insurance. Okay. So they will guide you about the mistake. Regarding the
Which
parent,
department, doctor?
actually presently I'm not remembering the name. Maybe it will involve the education supervisor or something. I will connect to you in shortly, okay, about it. But about the mother, you are worried. We will just tell that it's a teamwork and it's a mistake of a team, okay, and she will complain against the whole team if she
Okay.
wants to complain. Am I clear with you, Josmin? Do you have any other
Okay.
concerns?
No, doctor, that's it.
Okay, I see you're worried. What I can tell you is you can, I will give you some leaflets about the acyclovir and its side effects from the overdose. You can go through it, and also you can come back to me if you have any concerns. We will have one more meeting. Can you summarize to me what we discussed today?
No, doctor, I'm not in a position to summarize. I'm not in a position to summarize.
Okay, no problem. We were discussing about SAMI and about the incidents happened about double dose of acyclovir. So how to avoid the incidents and to do the best for the baby by monitoring the baby and to avoid the further drug errors.
Okay.
Jasmine, I again want to reassure you that don't worry and try to avoid, be clear when you prescribe the drugs. See to it that you're giving the right dose with the right, under the right weight, and double check. Always ask your sisters also to double check it. Okay.
Okay. Okay, doctor. I'll try my best.
Thank you.
There are 38 seconds left.
Okay, just 1 minute. Give the feedback. I hope I'm not speaking much. This is my problem.
Just that in the last, no, just utilize the time somehow. Even if the time is left, rather than this, just utilize the time somehow. By
I'm
otherwise,
feeling that it's more than 6 minutes, 9 minutes. I don't know why.
when yeah, no,
That
no,
what I feel is when we are playing better to avoid, when we are talking better to avoid keeping the time, should give to someone else, because it will cause some disturbance in between.
uh,
Give the feedback.
no. Otherwise, Alhamdulillah, it was covered nicely. You kind of made the points clear at the same time. Try to pacify.
Okay, I want to tell you the department. Do you know the department
Yeah,
name?
that's what I'm searching for. The department. There is this
Actually,
department's
it's a
name given.
quality department where they do the incident
No,
reporting and all.
no, no. Quality is for incident, but there's one department which will help the doctors, you know, if there is any, that is, I'm searching that in Rebecca for that same
Is
department.
it clinical governance?
No, not clinical governance.
No. So if you don't know, you will just tell that there is a department in the hospital which will guide you when the mistakes will happen. And also every doctor will have this medical insurance, right?
I think it's a GMC only, right? Which is
It is
protecting.
not a department. It is a legal consultation.
Legal.
It's called the Medical Defense Union.
So the
Okay,
department
I
is not
really
in
don't.
hospital. How she will consult? Can you just tell us?
Every doctor in UK has an account in this Medical Defense Union, and they get the account for free, and then they do a legal consultation about the incident.
Okay.
It is in Rebecca.
Yeah, that's what I'm.
Do you know
Which page,
the
Rebecca?
number?
It is in the scenario where the SHO missed the meningococemia.
Yeah.
Okay, we will search.
Okay.
Actually, this I didn't know. So I told her off that there is a department and we will be guiding. Actually, how much to read from where to read, I don't know. Okay, can you repeat again? Let me write it here before I see. Medical Defense Union, they will be connected to this agency or what?
Yes, the doctor will have direct connection with them.
And he will
I'm just searching for the page also.
He will make a legal consultation.
Yes, legal consultation about the critical incidents. Yes.
Okay, great. Okay, let's move. You can search and let us know, no problem, or post the page in the group as well. You are in my group?
Medical Defense Union, she's right. It's Medical Protection Society, MPS, and MDU, Medical Defense Union. Both of them. MPS and MDU.
Can you post click the page?
Page number 183, Rebecca 183.
Okay. Okay, all of you go back and see, because in this I don't have Rebecca. I will see it later. I just wrote down the page. Because this case, like these cases can come. A doctor made a mistake, and now we will go with the mother. Okay. For other scenario.
Noor, any other feedback? Anything else?